The term investment has gained popularity in the last decade, especially over the last couple of years. You see a lot of people talking about investment, where to invest, whom to invest with, which platform to select, which sector to select, and a lot of such videos. And you're usually confused. If you're thinking about a sector, I would recommend one. In fact, it wouldn't be me who recommends it. It would be Mr. Rakesh Menon and Mr. Srikrishna, founder and co-founder of Previu Health, who would tell you where to invest, which segment to invest in. Welcome.
Thanks, Renu.
Thank you.
So Rakesh, I would ask you first, why would anybody invest in a healthcare sector?
One of the fastest growing sectors in the world, one of the fastest economies in India, booming economies, healthcare being one of the most kind of favorite space for private equity firms and VCs. I'm an ex-banker myself, and so definitely choose healthcare as one of the spaces because this is the biggest need and this is very recession-proof and it's always going to be green. And with a 144 crore population which India has, this is just the start of the journey. So this is definitely healthcare and single specialty clinics and those kind of sectors are going to boom.
I would ask one more thing. As an investor, if I'm an investor, I would want to know how much return I will get. What are my profits? What am I going to get out of the bigger picture and stuff like that? So can you please explain that?
I think healthcare, as we all know today, right? So almost every human being requires an healthcare, right? That's whether it's a birth all the way up to the things, right? So in that perspective, today healthcare is one of the booming sectors, as Rakesh was telling about, as a private equity. Largely because of two things. One is in high growth sector. There is a lot of investment and newer technologies are brought into healthcare. So high growth is one thing why healthcare is very lucrative. The second part is with the kind of paying capacities that is increasing in India among the population as well. So it also brings a good returns actually, anywhere between 50 to 20% returns that it gives. That is, I think, is from an investment perspective, it's very exciting for the people.
And then I would ask, why specifically in CancerCare? Why would I invest specifically there?
The cancer burden in India has multiplied over the last few years, I think primarily due to the lifestyles and the kind of population kind of mix, changes in kind of demographics as such. So definitely given the fact that cancer itself as a disease is growing, so also the demand for high quality care, especially in tier 2 and 3 cities across, because right now it's clustered only in the metros. So that's one of the key reasons we feel, and that's happening, and you can see the market trends actually. You'll see all the giants actually making leading investments across the country in oncology specifically.
Yeah, I understand that. Cancer, we hear about it. There are many houses where you see 3 to 4 cases of cancer. I myself have experienced, but I would want to know, if I'm investing in CancerCare, why should I invest in Previu specifically, that healthcare?
Yeah, I think, see, one of the, as Rakesh was saying, right, today, as beautifully you also told, cancer is a day-to-day, it's a family disease it has become. Just like once upon a time we used to talk about diabetes, right? It is today, it's cancer. Every household has a cancer today, number one. Number two is the stigma around the cancer, right? The moment you heard the C word, right, there is a lot of stigma around it actually. That is slowly getting dispelled, right, with the kind of people coming back, whether it is cricketers or actresses who are all there, they are all showing a promise of comeback. So that is the second point of why people see that this is not something that I should fear, the second one. The third thing is why Previu. I think Rakesh would be a...
I think you will not find a company like Previu, because Previu looks at the entirety of cancer. The term itself is PREVIU. PREV stands for preventive. And the only cure for cancer is early detection. So unless the whole country shifts to early detection, because as you know, in the UK, and you yourself have been in New Zealand, these countries all go by early detection because the cost of healthcare is with the government. So that's one of the reasons why We also, I had a stint in the UK as well. So we've been through NHS and we understand how difficult it is even to get an appointment. And in India, currently with the kind of advancements which is there, this is the right, time to get into single specialty units like Previu. 3 things specifically. One is creating awareness among the population to break the stigma of the word C, cancer. Second is making care affordable. If you look at multi-specialty hospitals, they will end up charging more for the infrastructure.
Yeah.
Absolutely right. And if we get the whole cost broken down, and you would also agree that the pharma medicines which are actually being used, the huge margins which are being charged as well. So some of this, because we reduce the intermediaries in the supply chain, we bring care accessibility. So the 3 A's, awareness, affordability, and bringing care closer to their homes, kinds of breaks the whole stigma, gets care with kindness, empathy, and third thing, makes it affordable. And to an extent that today the government schemes are also really kind of lucrative enough to actually for private players to run on schemes. So that is in short why Previu. Yeah.
One more thing that we want to add is all the taglines that we use in Previu is we want to bring everything that matters in cancer care together. That is what we are aiming as a platform.
This is what I was about to ask next. So there are many people who say we're making it affordable. There are so many medicines. We can do this and that and that. But as an investor, what is that one thing, that one unique thing I should be looking at Previu?
Value.
Value.
We bring value to the investor for the capital which is being invested. So an investor would ideally put in money because they want return on capital employed. So we bring in that multiple, we multiply the capital. How do we do it? We scale it up. We are pan-India as we talk right now. Right from Trivandrum to Maharashtra to Chennai to across right up to Bombay. Across South, we are actually there. And we are not even scratched the surface of the whole country. There's so much of the hundreds of Previus can actually come. That's the kind of opportunity which exists here. So value also to the patient, right? In terms of care, in terms of affordability, and if you look at somebody who's undergoing chemo care today, they have to travel 4-5 hours into a place like Kochi. So if you bring the care right to their doorstep, and then we also have technology which has been developed in-house to run distributed cancer care. As a doctor who's sitting in Bombay can actually supervise the patients in Idiki. This is what we bring in as a value. Yeah.